It's a surgical procedure, what we call as a adenoidectomy. Now, what do you mean by adenoidectomy? Adenoids are tissues at the back of the nose, where the nose joins with the throat. They are just like tonsils. They help in the immunity when the child is sick. But sometimes, because of irritation or infection, frequent infection, all that, that itself acts as a source of problem. Where I already posted a video here about something known as pediatric sleep apnea. You will also find the link here. You can go there and you can see it. So when the adenoids are there, what happens? The child, he or she will have frequent nose block. They'll always be opening the mouth. You can see the teeth getting wide apart. These are known as adenoid phases. Sometimes it can also be very severe and lead to a condition known as failure to thrive, where the child will not be able to eat, because as soon as the child closes the mouth, the child will not be able to breathe. So the survival mechanism kicks in and the child just swallows or doesn't eat properly. If you look at it, the child will be extremely thin and unhealthy. Okay, so but then I put a scope through the nose and an instrument known as a coblator. And the coblator will be going through the mouth. We do it. Why I use coblator? Because it helps in complete removal of the adenoids. I also posted a video on my regular YouTube as to why I have stopped doing what we call as curating. 90% of them still do, but I have stopped doing. And if patients say they want to do that because of cost factor, I say no. So how much is going to the cost difference? Probably for the coblator, the wand will cost close to about 20,000 rupees. That the insurance may or may not cover. If the insurance doesn't cover, you have to pay from your hands. But that helps in complete removal. Here I am showing you, the picture of what the area looks like after complete removal. So if you see there, you can see up to the fascia and up to the beneath the region. What the fascia is a lining which is below the adenoid. So we have to remove until then. If you're not going to remove until then, the adenoids are going to come back. All the problems which are persistent are going to persist, though not so much as when it was big. So, and this also helps in preventing the bleeding. Now, how is the child going to feel? Yes, as soon as the child wakes up, the child is going to keep on crying. It's not because of pain or anything. It's because the child is going to be very, groovy or croaky because of the anesthesia. That lasts about 2 to 3 hours. After that, the child will be back to normal. It's a very safe procedure. It gives so much of relief to your child. You will see a new child altogether within about few weeks. If you want to know about it, yes, you can see the video and you can also go to the links, and if you want to contact, you can contact me.